Hi there. So my name's Ellie, if we haven't met before, and today we're going to spend just 5 minutes or so talking about trigger points and what they are. So you may have come across trigger points before, you may have heard of the term trigger points. So I'm just going to give you a brief overview of what trigger points are, and hopefully from that, by the end of the video, you'll have a better understanding of how trigger points actually can relate to any pain or discomfort that you're having, especially in the head and face and jaw area. So what are trigger points? You may have heard this term before, trigger point, or you may have heard trigger points referred to as a knot in a muscle, because that's a similar thing, really. So if you've wondered exactly what that term means, then we're going to go into a bit of depth here. So trigger points can also, as an aside, be misdiagnosed as a trapped nerve. So I often come across that with the clients that I help with headaches, migraine, jaw pain especially. They've been told they have a trapped nerve when actually it's trigger points in the muscle. So as I said, you're probably familiar with the term knot in a muscle, and you may even have felt that sort of tight, aggravated feeling of a knot in a muscle. It can feel quite hard or lumpy or even painful. Maybe you felt it in your shoulders or your back, or you may have been told by somebody when you've been for some sort of reflexology or massage that you're full of knots. I hear that quite a lot as well. But they also can be hidden in deeper muscles that aren't easy to palpate and that we might not feel when we're having a prod around with our fingers. And often these deeper muscles are responsible for many types of pain, is particularly headaches and jaw pain, and even things like back pain and sciatica can be caused by trigger points in these really deep muscles. So how do trigger points get there in the first place is a question I'm asked a lot. Most of the time, the cause is idiopathic, which is basically science language for we don't know. Our best guesses are, and also things that have proven to be true in my own experience, have been overuse of a particular muscle or particular muscle group, past injury possibly, and really not to be underestimated is the effect of stress, anxiety and trauma, and the ability for those type of conditions to actually cause muscle dysfunction. And if you think about a spring as a good example, so if you imagine that a spring is just in its relaxed state, so it's not really squeezed together, it's not being pulled apart, it's just in its normal state. So every time that a muscle contracts, so every time that you use a muscle, the fibers in the muscle draw together, a bit like a spring coming together. Then every time you stretch a muscle, they come apart, a bit like a string being pulled apart. So when we're thinking about overuse, which can be doing a repetitive activity, it could be because of posture, the muscles are working harder, it could be because we're stressed and we've got our shoulders up by our ears way too often. If you think about a spring contracting, so every time we use that muscle, the muscle's contracting like a spring does. So the fibers in the muscle are coming together to provide strength and to actually make a joint move. So and what they should do is every time those fibers come together, they should glide back. When you're finished using the muscle, they should glide back to where they were. Well, sometimes those fibers come together and contract like this, and then they don't actually release again. So what happens is you have a muscle which has many fibers in it, and one of those fibers is stuck like a spring stuck together. And then once you've got one, sometimes others can start to join in on the party, and then sometimes other parts of the muscle in a different sort of area. So say this is at the top of a muscle, at the bottom of the muscle, that part can start to not release itself and become trapped. So hopefully that analogy kind of makes some sense. So if we think about using a muscle, every time we use it, it contracts. And sometimes trigger points are formed because the muscle doesn't release again. And that really makes sense with what we were saying about the cause of trigger points when we think of overuse, stress, posture, that kind of thing. So that's really how trigger points are formed and how they get there. So, and in terms of the texture, like we said, they can feel like a knot, they can feel like a pulling, they can not really feel like anything at all in some case, and you might just feel the effect of the trigger point in a different area. So really what we're looking at there is muscle dysfunction because of the trigger points. So they're not able to do their job as well as they should. And not only that, but the trigger points can refer pain into other places as well. One little one on its own really isn't too much of a problem. You know, one little knot in a muscle isn't really, you know, that's sort of day-to-day life. But the trouble really starts when we start to get a whole load in one area or a bigger trigger point. Remember, like I said, sometimes when it gets stuck together, other muscle fibers will start getting drawn towards it as well. And that's really when the muscle starts to feel tight and restricted, and the performance of the muscle can be severely impacted by trigger points. So the trigger point can cause the muscle to not be able to do its job properly, and that can then cause other muscles to have to overcompensate and do the job of that muscle, and then that muscle starts to get fed up, and as you can imagine, it can turn from one thing into a bigger thing over time if it's not remedied. The next thing that I wanted to just briefly touch on is the fact that we have something called satellite trigger points. So what can happen is a muscle can get a trigger point in it, like we've just discussed, and then that actually can refer pain to a different area. So for example, upper trapezius along here is notorious for referring pain into the jaw area. And what will happen over time, if that isn't remedied, is that the jaw then starts to set its own trigger points, so its own problems in the jaw muscles. And then so one area starts and it sets off another area, and that's basically what we call satellite trigger points. So trigger points in one area can set off satellite trigger points in the other area. And no matter how much you treat the satellite trigger points, if the root cause isn't sorted out, then they will just keep coming back, and we go through this cycle where it's just a constant repetitive, you know, it feels a bit better, it gets worse again, it feels a bit better, it gets worse again. So lastly, what are the effects of trigger points? Well, the most prominent and inconvenient effect of trigger points is that they cause pain, really. That's the kind of thing that has the most impact on us. And they actually have a predictable pattern of pain, so a predictable pattern of referred pain into other areas of the body. So I'm just going to show you a quick image here, and you'll see how just one muscle can cause so much pain. So hopefully you can see that here. So this is just one muscle in your neck. And if you look at the pain that it can cause, we've got pain sort of under the jaw there, we've got pain at the front, this big area of pain around the eye, which can often be mistaken for migraines. It can refer to both sides of the head. It can refer into the ear, so you can feel like you've got earache or tinnitus, etc. So this particular muscle on the neck is known for this referred pain pattern. So it's not just that muscles will refer pain in any old fashion. It is that we have these known patterns that of referred pain that are caused by trigger points in certain muscles. So I hope that makes some sense. The second thing that trigger points can do is cause what we call autonomic phenomena. And this can be a very strange thing to actually think about being caused by a muscle, but autonomic phenomena covers things like a watery eye, a stuffy nose, a dry cough for no reason, a stuffiness in the ear, excessive sneezing, sort of sinusy, bunged up feeling. So it's very strange to think that any of that could be muscular, but I see it time and time again that this type of phenomena is caused by muscles, and often muscles in the neck that are causing not only pain but this strange phenomena as well. And clients are often kind of amazed that these symptoms go away when they learn how to treat these muscles. Even vertigo is something as well that can be muscular related, which I think is really amazing. So trigger points can be to blame for a lot of diagnosed conditions and are a source of the pain, are a source of a lot of pain. So we've only really just come to understand the role of trigger points in Western culture. Much of this work was brought into the limelight by an amazing lady called Dr. Janet Travell, who was actually JFK's private doctor. He brought her into the White House with him to treat his conditions that he suffered with. And she went on to really map out these pain patterns. And from there, it's been sort of taken on board into Western culture a bit more. But, you know, a lot of this ties over with acupressure points, which are a whole different system and a whole different way of looking at the body. But it's amazing what the crossover is between what has been known for a long time in Eastern culture and what we're really only just coming to understand in Western culture. So I hope that that made some sense as to what trigger points are, how they got there, and the type of problems that trigger points can cause. Do let me know if you have any questions on this. I'm always trigger points are one of my most favourite things to talk about. So I'm always really happy to answer any questions that you may have on this. So I hope that makes sense, and thank you for watching, and I'll see you soon.